Hello friends, my name is Dr. Sajjadpathan and today we are going to look at MRCEM primary buzzwords part 6. This will be basically dealing with the anatomy of the lower limb. So let's begin. What are the dermatomes at umbilicus, suprapubic area, inguinal ligament and first web space? So the dermatomes are T10 at umbilicus, suprapubic is T12, inguinal ligament is L1 and the first web space of the foot is L5. What are the root values of ankle jerk and knee jerk? So the ankle jerk is S1, S2, knee jerk is L34. So S1, S2, L34. Saphenous vein actually arises from the dorsal venous arch of foot. Dorsal venous arch of foot. Saphenous vein location at the ankle. So if you look at your ankle at this moment of time, you will know where it is located. It is anterior to the medial malleolus. It is anterior to the medial malleolus. Saphenous vein drains into the femoral vein. Saphenous vein drains into the femoral veins. Sartorius origin and insertion. You need to know this origin and insertion. Sartorius originates at the anterior superior iliac spine and it inserts at the proximal tibia medially. It originates from ASIS and inserts at proximal medial tibia. The classical could be they can show you an x-ray showing an avulsion fracture at the anterior superior iliac spine, and that is your sartorius avulsion fracture at the anterior superior iliac spine. Name the quadriceps. There are four muscles from the quads in the front of the thigh. They are rectus femoris, vastus lateralis, vastus intermedius and vastus medialis. They all insert on the patella and then form the patellar ligament, which inserts on the tibial tubercle. Functions of quadriceps: it helps in extension of the knee. Extension of the knee is the function of quadriceps. What is the nerve supply of quadriceps? Quadriceps is in the anterior thigh. Nerve supply would be femoral nerve. Nerve supply for quadriceps is femoral nerve. Femoral sheath. What exactly is femoral sheath? Femoral sheath is actually a funnel shaped extraperitoneal fascia of the abdomen. It's the funnel shaped extraperitoneal fascia of the abdomen behind the inguinal ligament. What does femoral sheath contains? It has three compartments. The lateral most has femoral artery and a genitofemoral nerve. Remember, the femoral nerve is out of the femoral sheath. So the lateral compartment of femoral sheath contains femoral artery. The intermediate compartment contains femoral vein, and the medial compartment is usually empty or may have some lymph nodes. The lateral compartment of femoral sheath contains that's femoral artery and the femoral branch of genitofemoral nerve. It's not the femoral nerve, it's the femoral branch of genitofemoral nerve. Femoral artery can be palpated at mid-inguinal point. Mid-inguinal point is the femoral artery. Femoral canal, it is the innermost, the medialmost compartment of femoral sheath through which there could be femoral hernia, especially in a female. Femoral nerve roots, these are very important. L2, 3, 4. Femoral nerve roots are L2, 3, 4. Obturator nerve roots again L2, 3, 4. So femoral and obturator nerve roots are L2, 3, 4. Femoral comes to the anterior part of the thigh. Obturator goes to the medial aspect of the thigh. Sciatic nerve roots. The sciatic nerve roots is L45, S123. L45, S123, and this goes to the posterior part of the thigh. Sciatic nerve divides at what place and divides into what? It divides at the apex of popliteal fossa. The sciatic nerve divides at the apex of popliteal fossa, and it divides into the tibial and common peroneal nerve. It divides into tibial and common peroneal nerve. Common peroneal nerve injury will lead to what problem? The common peroneal nerve is like the radial nerve. Radial nerve injury leads to wrist drop. Common peroneal injury will lead to foot drop. L1 and L2 roots combine to form genitofemoral nerve. So L1 and L2 combines to form genitofemoral nerve. L2 and L3 combines to form lateral cutaneous nerve of the thigh. L1, L2 genitofemoral nerve. L2 and L3 lateral cutaneous nerve of the thigh. L2, 3, 4 combines to form femoral and obturator nerve. Boundaries of femoral triangle, you need to know this. One is sartorius, inguinal ligament and adductor longus. It's longest. Okay, sartorius, inguinal ligament, and adductor longus. Floor of femoral triangle is formed by iliacus, pectineus, and psoas tendon. Iliacus, pectineus, and psoas tendon. Femoral artery is a continuation of external iliac artery. Femoral artery is a continuation of external iliac artery. Obturator artery is a branch of internal iliac artery. Obturator is a branch of internal iliac artery. Pudendal nerve roots is S234. So pudendal nerve S234 keeps 3 p's of the floor. S234 keeps 3 p's of the floor. That is pee, poo, and penis. So it constricts your anal sphincter, constricts your urethral sphincter, and helps in erection. S234 keeps 3 p's of the floor. Boundaries of popliteal fossa: superior medially it is semimembranosus. Membranosus medially. Superomedially is semimembranosus. Superolaterally it is the biceps femoris. Inferomedially is the medial head of gastrocnemius, and inferolaterally there are two things: lateral head of gastrocnemius and plantaris. Plantaris, PL, L is lateral, lateral head of gastrocnemius as well. Deep peroneal nerve supplies the first web space of the foot, which is L4, L5. Deep peroneal nerve supplies the first web space of the foot. Safe site of intramuscular injections in the gluteal region, it is the superolateral quadrant. Superolateral quadrant is a safe site to give intramuscular injections in the glute region. Deformity seen in medial collateral ligament injury in the knee. So if there is a medial collateral ligament tear in the knee, it will give rise to valgus deformity. Valgus deformity. Deformity seen in the lateral collateral ligament injury in the knee is your varus deformity. Dorsalis pedis artery is a continuation of anterior tibial artery. Dorsalis pedis, which you feel on the foot, on the dorsum of the foot, is a continuation of anterior tibial artery. How many compartments are there in the leg? How many compartments are there in the leg, and name them? There are 4 compartments. One is anterior, then there is a lateral or peroneal compartment, then there is posterior superficial and posterior deep compartment. So 4 compartments: anterior, lateral, superficial, posterior, and deep posterior. Muscles of peroneal compartment, the name itself says peroneus longus and peroneus brevis. Peroneus longus and peroneus brevis. Insertion is commonly tested. Insertion of peroneus longus, it's a long muscle, has to go from the lateral compartment all the way to the medial aspect of the foot to insert at the first metatarsal, whereas brevis is a shorter one, have to travel shorter, 5th metatarsal. Longus, long one; brevis, the short one. Ankle joint is stable in what position? Ankle joint is stable in what position? It is stable in dorsiflexion. It is stable in dorsiflexion. Deltoid ligament is attached to which malleolus? Is it medial malleolus or lateral malleolus? Deltoid ligament is attached to medial malleolus. Deltoid ligament is attached to medial malleolus. It has nothing to do with the deltoid muscle of the upper limb. Deltoid ligament is attached to the medial malleolus. Ligament of lateral malleolus, there are 3 ligaments of lateral malleolus, which is ATFL, PTFL, and CFL. Anterior talofibular ligament, which is the weakest one, then posterior talofibular, and then calcaneofibular ligament. Eversion of the foot. Eversion of the foot is done by the lateral compartment, peroneus longus and peroneus brevis. Inversion of the foot is done by tibialis anterior, tibialis posterior. Inversion of the foot is done by tibialis anterior and tibialis posterior. There are dash muscle layers in the sole. There are what number of muscle layers in the sole? There are 4 muscle layers in the sole. And the last part for today is the plantar. The plantar arteries and nerve lie between which layer in the sole of the foot? It lies between the first and the second muscle layer. So there are 4 muscle layers, but the arteries and nerves lie in between the first and second muscle layer. Thank you for watching this video. If you're liking this series, please hit that join button, subscribe, or if you want to contribute financially, you can hit the thanks button. Thank you for watching. All the best for the exam. Study well. Peace.